Hello everyone, my name is Elvita Diaz and I'm working with my partner Heather Clutter. We'll be discussing neurocognitive disorder, focusing on dementia. Butcher states dementia is a progressive clinical condition that is experienced as an array of symptoms including memory loss, difficulty expressing language, impaired communication, and ability to reason effectively. Dementia is a disease that impacts everyone around the world. Just if you look here at the numbers around the world, in 2015, 46.8 million people were affected or impacted by dementia. In 2030, 74.7 million people. It's expected that those numbers will continue to rise. And as you see here, in 2050, around the world, is it expected that 131.5 million people would be impacted by dementia. In the United States alone, in 2015, 9.4 million people were diagnosed with dementia. In 2030, it is expected that 15.8 million people will be diagnosed with dementia, one form of dementia. And by 2050, 29.9 million people will be impacted by dementia in the United States. So just gives you an idea of how severe and how so many people around the world are impacted by dementia. And all of you may know someone who has any form of dementia. So I think all of us are pretty familiar with how severe this is. Dementia falls under the neurocognitive disorders. Under neurocognitive disorders, there's dementia, delirium, amnestic, and other cognitive disorders. But as I mentioned, we'll be focusing on dementia. Dementia has initial slow chronic. It is a slow chronic onset. There is typically an underlying brain disorder. There is no cure as it continues to progress. So, although some individuals or patients may get medications to kind of slow the progression and help manage their certain symptoms, but there is no cure. One who has dementia, their attention begins to decline. So within dementia, there's 3 stages. There's early stage, middle stage, and late stage. For someone who has, where their attention begins to decline, what we're talking about is their memory loss, difficulty with words, or issues with time. However, someone who's in the early stages, they're unimpaired. They're still able to live on their own. So, for example, I have patients who live in assisted living facilities and may be referred to hospice because they have the early stages of dementia, which doesn't necessarily mean that they're hospice appropriate, but sometimes their doctors may refer them to hospice because they're beginning to have their early stages of dementia. But they're still able to function and live in an assisted living on their own, but with some help. As one's disease or dementia begins to progress, it does affect their speech, their memory, and their perception. So someone who may have increased memory loss, increased difficulty with orientation of time and place, difficulty with communicating. Other common issues would be issues with personal care, or, for example, in their impaired late stages, an example would be is they're no longer able to perform their activities of daily living. They're unable to recognize people and items that were familiar to them, and they're no longer aware to their surroundings. So, for example, some of my patients who've been referred to hospice who have late stages of dementia, they were previously in an assisted living facility. However, they're no longer able to be there because they require a higher level of care. They're now incontinent. That means they're no longer able to go to the bathroom on their own. They require a lot of assistance with ambulating from their bed to a wheelchair or walker. They're not able to bathe themselves. They have difficulty with communicating, or even difficulty in understanding their surroundings and any situations that may come about. Difficulty with swallowing is some of the common concerns that families have with their loved one is that they're no longer able to eat, and also mainly bedridden. So unfortunately, it is a terminal disease, and it's really hard to see when I get my patients who have Alzheimer's or dementia being referred to hospice, because they have such a significant decline, and they continue to decline as the disease progresses, because it is a terminal illness. Dementia, under dementia, so dementia is an umbrella term used to describe a range of symptoms associated with cognitive impairment. So here, when we're talking about dementia, we always hear about, I think as a society, we're very familiar with Alzheimer's, but we're not really familiar about the other forms of dementia that fall under this umbrella. Alzheimer's, as you can see here, 50 to 75% of people are affected by Alzheimer's. And Alzheimer's causes problems with one's memory. It develops typically with someone who's over 65 or older. And as I mentioned, it is a progressive disease. And it is a disease that has a pattern. So there are certain patterns that a patient may have as their disease continues to progress. Now, unlike with vascular dementia is the second most common form of dementia. 20 to 30% of people are diagnosed with vascular dementia. Now, a person who has vascular dementia has changes in their thinking, and it's typically followed by strokes. So someone who has a stroke typically is diagnosed with a vascular dementia, because their blood vessels are impacted. There is no pattern in comparison to Alzheimer's. There is no pattern that a patient who has vascular dementia that it follows. So it's most obvious when a person who has a stroke that they experience confusion, disorientation, or even trouble speaking. Now, when we're talking about Lewy body dementia, 10 to 25% of people are affected by Lewy body dementia. Lewy body dementia affects a patient's memory and movement. It also it develops in the nervous system and brain regions, and it is also a progressive decline. Frontotemporal dementia impacts 10 to 15% of people. And some of you may hear from some celebrities who've developed frontotemporal dementia. It's actually referred to as amyotrophic lateral sclerosis, ALS. And with this, a person who has frontotemporal dementia, it affects their muscle and motor function. So it significantly impacts their ability to move around, or even function overall, I should say. Under neurocognitive disorders, there are syndromes that one may experience. So someone who has major NCD, as I mentioned earlier, there are early stages of dementia, middle stages, and late stages. For someone who has major or is in the middle to late stages of dementia, they have increased difficulty with stimuli. So meaning taking them out of their normal environment. Let's say for a patient who's in a memory care unit, taking them out in public to be surrounded by many people could be too much for them. Difficulty in holding new information. So an example would be if you're giving someone who has this progressive dementia an iPhone. They've never used an iPhone, and you're giving them an iPhone and trying to teach them how to use it. That may be too much for them to understand, and they may have difficulty holding in all that new information. Another example is they repeat themselves in conversation. So because, again, the memory loss and they forget that they've mentioned something, they have to constantly repeat themselves during a conversation. Behavior that is behavior out of acceptable range. This could be combativeness, again, because they're out of their normal surroundings, and taking them out of their surroundings can cause some agitation, anxiety. And I'm speaking from experience with my patients who have dementia, where families share with me that they become combative, or they have increased changes in their mood or behavior, and again may display inappropriate behavior. Navigating in familiar environments. So this was the example that I was speaking about earlier, is someone who was in assisted living. I have patients who are in assisted living and no longer able to be in an assisted living and need a higher level of care. So they are transitioned to a memory care unit where they have caregivers 24/7 who will help them with bathing, with all their activities of daily living because they're no longer able to do that on their own, with feeding, incontinence. So again, someone who has major NCD, they're no longer able to live on their own. In comparison, though, there is that mild NCD, and this is for someone who's in the early stages. And someone who's in the early stages may have increased difficulty with tasks. So let's say, for example, with maybe handling bills, being able to pay their bills, so their family has to help them with that. Socializing gatherings are less enjoyable. I think because of their they don't like being around a lot of people because again, it's difficult handling being out of their normal environment. They need reminders, so this could be needing reminders to go to the doctor, so needing reminders to take care of themselves or be able to do certain activities of daily living. Subtle changes in behavior. So in the early stages of dementia, as I was mentioning earlier, it's memory loss, difficulty with words, issues with time, issues with finding finding in familiar places, issues with handling complicated tasks. So those are some of the things that family members may mention, is that with their loved one is that they start to notice a change in their behavior. Because I think what happens is that someone who has dementia, they become frustrated with themselves because they're forgetting things, or they're having difficulty forming words. I came across this video here that speaks on what we're talking about, the progression from mild to advanced progression of dementia. We were talking about the social withdrawal, the ability to complete familiar tasks, or changes in behavior and their mood. So I thought this would be a great video to watch. Because I know most of us know about Alzheimer's dementia. Vascular dementia for me was a little bit more complex because there is no pattern, and it's typically for someone who has who suffers strokes and has other comorbidities. So I thought it would be good to post this video here on vascular dementia. So I hope you enjoy this. And now I'm going to go ahead and hand it over to my teammate Heather, and she will speak on the rest of this on dementia. Thank you.